Good afternoon, everyone. Today we'll be talking about contraceptive spermicide. So, what is a spermicide? It is a chemical substance designed to kill or disable sperm, acting as a contraceptive method. It is applied inside the vagina before intercourse to prevent sperm from reaching and fertilizing an egg. Keep in mind that it is often recommended to use spermicide in a combination with other contraceptive methods for increased effectiveness. These are the methods in which you can use spermicides. First are creams and gels. It is applied directly into the vagina before intercourse. Next are foams. Similar to creams and gels, but in a foamy consistency for easier application. Next are suppositories. Solid forms inserted into the vagina where they dissolve. The last ones are films. These are thin sheets placed near the cervix, dissolving to create a barrier against sperm.
So how does spermicide work? So spermicides block the cervix, which is the opening to the uterus, and slow sperm down to make it harder for them to swim to an egg. So in order for this to work, the spermicide must be placed deep in the vagina close to the cervix. So the creams, gels, and foams are squirted into the vagina using an applicator. Other types of spermicides include VCF, which is the vaginal contraceptive film, a thin sheet placed in the back of vagina by hand, and vaginal suppositories. So, spermicides must be placed in the vagina before sexual intercourse. The instructions will say how long before sex the spermicide should be used, and most must be placed in the vagina for at least 10 to 15 minutes before sex, so they have enough time to dissolve and spread. So many forms of spermicides are effective for only 1 hour after they are inserted. Okay, so let us proceed to the effectiveness of using spermicide. So when used alone, spermicide is about 72% effective at preventing pregnancy. So this means that about 28 out of 100 typical couples who use spermicide will have an accidental pregnancy each year. However, when used with a diaphragm or condom, spermicide is about 92% effective. So let us proceed to the factors affecting the effectiveness of spermicide. Number one is how it is used. Spermicide must be used correctly in order to be effective. So this means following the instructions carefully and using enough spermicide. Number two is the consistency of use. Spermicide must be used every time you have sex in order to be effective. And number three, timing of use. Spermicide should be inserted into the vagina 10 to 15 minutes before sex. And lastly is the individual factors, because some women are more likely to become pregnant than others even if they are using spermicide correctly. This is because some women have more fertile vaginal fluids than others. Okay, so let us proceed to the considerations when using spermicide. So the things we need to consider are the advantage of using spermicide. So here are the some of the advantages. Number one is it is inexpensive. It's easy to use and apply. You can buy spermicide at most stores and supermarkets. It doesn't contain hormones. It can double as a lubricant, and you don't need to visit your healthcare provider before using it. And also, let us consider the disadvantages of using a spermicide. So, the disadvantages of spermicides are it has to be used correctly and according to the instructions on the label. It has to be reapplied each time you have sex. It doesn't protect against STI or sexually transmitted infections, and it may cause irritation and pain. It can also increase your risk at getting HIV infection, and it has been also linked to increase urinary tract infection or UTI. So remember, talk to your healthcare provider if you have concerns about using spermicide as a birth control method, and they may also recommend another contraceptive method for you based on your health history. So here are the comparison of the different contraceptive spermicides. So we have films, foams, suppositories, sponges, jellies, and gels. So when to use? So mostly are 15 minutes before sex. For the sponges is up to 24 hours, and for the foams is 1 hour before sex. For the effectiveness is up to 1 hour. For the films is 3 hours. For the sponges is up to 24 hours, and for the jellies is up to 6 hours. And each of them are used with condoms. And for the jellies, it is also used with with either condoms or diaphragm of cervical cups. So in conclusion, spermicide can be effective in preventing pregnancy when it's used with other forms of birth control. So it's important to use spermicides as directed and pay attention to any side effects like irritation or sores. Moreover, spermicide is not the most effective form of contraception and does not offer protection from STIs. Therefore, many experts recommend using spermicide in combination with other birth control methods, such as condoms.